A very good afternoon and welcome to our session on a very important topic that is menopause. We are glad to have Dr. Teena Thomas among us today to help us understand the topic. The doctor will help us understand the important details and all that it covers under this topic. I request to post all your queries and doubts on the comment section so that the doctor is able to answer that. Doctor, you have the stage.
Good evening, all. Today we are going to talk on a topic called menopause. Now, menopause is a time which marks the end of your menstrual cycle. Every woman, after every girl, when she is born with all the number of eggs that is available. Now, these eggs start releasing once she reaches menarche, and by around 40 to 50 years, there is a time when the entire mm, egg gets degenerated and there are no more eggs to come off. So, by the end of 40s, there will be no eggs left in the woman's womb, the body, and hence that starts the second era, the next era in the life of a woman called menopause. Now, this menopause can be usually is at the average age of menopause is around 51 years plus minus 2 3 years. So it can be any time after 46, 47 to 53, 54, like that. So we average of a 9 to 10 years, but mostly around 51 years is the time when we expect menopause to come in. So how, when do you call it a menopause? When there is no menstrual cycle for almost 12 months. When a woman experiences no menstrual cycle at all for 12 months, that is when it is declared as she has reached menopause. Now, when you talk about menopause, there are three zones which we are looking at, three parts of menopause. One is perimenopause, one is actual menopause, and one is postmenopause. Now, before we come on to this perimenopause, menopause, and postmenopause, that are the three zones of menopause, there is something called premature menopause. Now, premature menopause is when, before actually the woman is at her late 40s or 50, early 50, she reaches menopause anytime earlier, very early. One reason of it is a surgical menopause. So, suddenly, due to some reason, if a woman has her uterus and ovaries removed at any point of life time, that is an abrupt stop of menstrual cycle, which is a surgical menopause, comes under premature menopause. Then it can be due to chemotherapy related menopause. So, chemotherapy or radiotherapy resulting in the stop of the menstrual cycles, that is again cancer related menopause. The third is primary ovarian failure or ovarian insufficiency syndrome, when in a young woman less than around 40 or less than 40, there is a sudden finish of all the eggs that are already stored. Then she sudden goes into an abrupt menopause, that is primary ovarian failure, that is premature menopause. So these are premature menopause. The symptoms are more or less the same but at a very early age. So when I discuss menopause, these are the same symptoms that you will find there. But then menopause comes with lot of symptoms and syndromes and lot of problems and benefits and negatives. So that may come in very early with a premature menopause, requiring other support systems. Now, when we come on to men and actual menopause, so here we know that it comes around late 40s, around 50 years of age, 50, 51 years of age. So then I told you that what we have three zones here. One is perimenopause, that are few years before the actual menopause. Menopause is the time when 12 months of no period. Then postmenopause is the time when you have already finished that 12 months, and then the postmenopausal phase. So, what are the problems and the things and the treatments in each phase? Perimenopause, when the few years before menopause, there can be lot of symptoms, perimenopausal symptoms, which a woman can face, which may lead to irregular cycles, which may be as irregular as once in 3 months, 4 months, 6 months, very less amount of bleeding, sometimes vaginal dryness, because uh, estrogen is so what actually is menopause? The eggs have stopped, menstrual cycle is stopped, and the two main hormones, which is the system of the woman, that is estrogen, progesterone, has come down. So estrogen is come down, which is the woman's hormone. Hmm? This estrogen is coming down and absent after menopause. So that is the main thing, that estrogen is less, going on less, and absent. So during this perimenopausal time, the estrogen levels come down very much, and the symptoms that we see during this time is all the effects of the less estrogen levels. So what what does this estrogen, less estrogen, what symptoms do they cause? Number one is it causes vaginal dryness, because the estrogen in the vaginal tissues have come down, so they cause little more dryness. There's lot of hot flushes coming up. So hot flashes mean suddenly when the AC is running, you start feeling very hot, sweat is coming out. That can be so difficult at times that people, yeah, and these ladies may not be able to go out in public. They try to avoid functions because the hot flushes are so bad, and they start sweating, night sweats. Then weight gain, unable to lose weight as much as possible, slowed metabolism, there is thinning of the hair, loss of uh, appetite. Okay, urinary control, maybe at times little incontinence can happen. So control over the urine, because estrogen again plays a very important role in that area. So urinary incontinence, maybe lot of mood changes, depression in some, anxiety in some. So these are few of the symptoms which come in during the perimenopausal time. Now, how do you treat these problems? So, first of all, is you should be able to appreciate that I am going through these problems, and few of these definitely require some help. So, how do you treat? How do you take it? Whether the person needs treatment during this phase or not? So it depends on the problems are affecting her quality of life. So these are all quality of life problems. So there may be different women at the same age group, running after so many things in life, that some may not feel that as a problem and move on. Some may feel as a problem and come and take help. So hence it is called quality of life problem. Example, I will explain that there are many women in India who, from the age of 35, after delivery and all that, they sneeze or laugh for a long time and little urine spills out. It's called urinary incontinence. Okay, and over years they take, Are, this is normal, this is something that happens in life, so nothing to be worried about, nothing to be done about it. So they take it, they change their lifestyle according to that, what has happened. I had one of my patients. She was a foreigner. Okay, she was German lady as far as I remember. In here in India, I had that patient. So after delivery, immediately after delivery, they just few months, few not even few weeks, few days, when she came back for a checkup, she said that the where the stitch was put, some little tissue was coming outside, which she was not happy with. So she went on to do horse riding immediately. So what does horse riding do? horse riding tightens up the pelvic muscle. So the tightening of the pelvic muscle is one exercise is horse riding. So she was making it very sure that in future she doesn't have urinary incontinence or any sort of incontinence, or pelvic floor muscle weakening should not happen. So that is the quality of life that that lady expected. So when any of these symptoms affect our quality of life, we need treatment, and we all have to upgrade our quality of life. So these are the quality of life problems, and hence any perimenopausal treatment can be given and taken care of very well, provided the person herself knows that she is going through a phase where she is suffering from many problems and which can be taken care of, need help and take help. So the entire part of treatment, I'll come all three together: the perimenopause and menopause and postmenopause. Okay, treatment part will be together. So these are the symptoms that we come across in a perimenopausal woman and can be treated and taken care of. Then menopause. So the 12 months when there is no period is again called menopause. Now menopause is a time when all these symptoms which I told will be at its peak. Okay, so I have a friend who says whatever I'm doing, my belly is not coming down. There's sluggish, though she runs marathon. Okay, so there is sluggish loss in the weight happening is less. Hmm? The stamina may come down. There are a lot of mood changes that come in, anger, anxiety. These are all part of the time when you go through these times that can be part of it. Acknowledging them is the first thing that we can help ourselves with. So during these menopause time, you can have bleeding problems. Some patients may. So, what are the most common complications that we see during this perimenopause and menopausal time is that you can have associated some disorders of the uterus, like endometriosis or adenomyosis or fibroids, which add on to your problems of the menopausal time. So adenomyosis is one condition which is usually age related. So more with age, some people tend to have adenomyosis where bleeding will be very heavy. So that person is suffering with heavy bleeding every now and then. But at the same time, when you are perimenopause and menopause, any heavy bleeding has to be treated and diagnosed so that we rule out any risk of future cancer coming in. So that is again one important thing. So this bleeding problems during menopause, if at all it is once in few months period comes and the bleeding is very less, then it is fine. Less bleeding, late bleeding, repeated missing of periods, but still the periods flow will be normal. If that is fine, it is fine. So during the perimenopause, you may have period once in 2 months, then continues to be 3 monthly one, then 6 monthly one. Finally, 1 year, no period is menopause. But if you have lot of pain during these periods, if you have heavy flow during these periods, or there are intermenstrual bleeding, or there is intermittent any bleed or postcoital bleed, anything needs attention of the gynecologist and examination and scan to be done to be seen if there is any other problem. So if there is nothing else, then we just have to deal with the perimenopausal and the menopausal problems that come in during this time. Now, what is so during this 12 months time, the lady has to go through all these things, but it also depends on how you take it. So there are, I always think that at from the age of 44, 45, I have patients who would come that with mood changes, with so many perimenopausal problems, and they would actually attribute everything to perimenopause. And sometimes I see very busy women at 49, 50. and they never would have recognized that they had any perimenopausal problem. So life has been so busy for them that they have not recognized it, and they have lived well. So if these problems are troubling you, definitely you need help and take care of it by treating it. But if these problems are not troubling you, you do not need any help for these, and this will just wean off as a normal biological process that happens in the body. So now 12 months without period and you have crossed menopause. Now the third zone of menopause is the postmenopausal period. Now postmenopausal period again can go. So a postmenopausal period is when you have diagnosed, you can yourself diagnose, because 12 months there are no period, and hence you diagnosed to be menopause. And then the period after that is called postmenopausal period. And the postmenopausal period, most of the symptoms will come down except for the mood changes. The hot flushes may take some more time to come down. The urinary trouble of incontinence or dryness may take some more time to come down. The vaginal dryness may also take some more time to come down. But otherwise, all other symptoms slowly regress very fast, and these also regress. But there are examples of women in the postmenopausal time when these symptoms may continue for 2, 3, 4, 5 years beyond menopause. There is another problem that we face in postmenopausal period, and that is the bone mineral loss of bone mineral density and the bone becoming very weak, and heart problems. Okay, that is because estrogen plays a very important role in not letting your bone density to come down and getting your calcium get more deposited into your bones. So estrogen is one of the factor which helps you to mineralize your more bones more with calcium and make your bones strong. And estrogen is one of the factor which avoids clogging of your heart vessels and blood vessels with cholesterol. So they are the ones will support you to avoid heart diseases and bone problems. Okay, so that is why if you would have heard that heart attacks are most common in women. Okay, but we do not see any woman less than 50 years having heart attack. You would have heard about young boys, 25-year-old, 30-year-old having heart attack, but a 30-year-old woman having heart attack I have not heard. Hmm? That is because we have the power of this estrogen, which is helping our hearts to be protected and our bones to be protected. So now that is when in postmenopausal uh, time of a woman, when she has no support of this estrogen, that is when she is open to any heart disease and demineralization of the bones, to the extent that the bone mineral density drops 1 to 2% every year, and may have lost 25% after some amount of menopausal era. Okay, so it is very important that all postmenopausal women are supported with enough calcium and vitamin D to support their bones, to avoid the brittling of the bone. The bone mineral density most commonly lost places are the hip, the wrist, and the spine, and that is why there is breaking of the hip joint in older women and spine problems in older women. That is because of the demineralization of the bone. So and hence this postmenopausal problem of bone deficiencies have to be dealt with for every woman, and and she has to have a annual checkup for her heart and a good exercise level to prevent any heart problems in the postmenopausal era. What more we see in this postmenopausal time? Definitely, as months go by, the hot flushes and the problems of such perimenopausal symptoms are all coming down, and she has also learned to cope up with these problems over these few years. to get out of it. So the symptoms have definitely come down, but now we are looking into more of science. I told you about the bone and the heart. Likewise, any postmenopausal bleeding. So if you have not had period for 1 year and you've reached menopause, then that is it. You are not supposed to bleed anymore after that. So any postmenopausal bleeding, so any bleeding after menopause has to be investigated to rule out any risk of future cancer. So, any postmenopausal bleeding, please do not sit at home. It has to be investigated and ruled out that there is no other problem, and it must be just due to absent hormones, which has caused enough dryness to cause a bleed. Maybe that is the reason. Other reason has to be ruled out. So, any postmenopausal bleeding has to be investigated. So these are the few things what we see in the perimenopause, the menopause, and the postmenopausal time. Now, how do you treat these things? Now, treatment, when we go to the treatment part of it, before we look into any medication that can be helpful on such time, the most important part of treatment comes in as number one is diet. So the first treatment point is diet. First thing is decrease the amount of fat and carbs in your diet, have more of proteins. Breakfast should be like king, lunch should be like a common man, and dinner should be like a beggar. Hmm? So, and increase your high proteins in your diet. See to that there is less of fatty food, because that again causes lot of night sweats and hot flashes. Then see to that alcohol consumption comes down during this time, because it is very hard to take it, because all the symptoms seem to increase with alcohol. So alcohol, smoking, all this should come down very much. Use of caffeine should come down during these times. So this is the time, and how this is how the diet has to be. More of fluids should be taken in. High intake of fluids and fruits, lot of vitamins and proteins should be part of the thing. So diet is the first thing as part of treatment. Second is exercise. Some form of exercise should be there at least 3 or 4 days in a week, so that you build up your stamina and you maintain proper physique of your body, so that the stamina build up and running around, because age is crossing over, you are into another era of your life, but still the your job at the forefront in your career and in your house and in your as a parent may still not have changed an era. Okay, so if it's good if that era is also changing, but may not have. So at this time you have to help yourself with a good exercise level. So good amount of exercise, at least half an hour, 4 days a week is minimum what is required. So good exercise level helps you bring down all these problems. So first is diet, second is exercise, third is attitude. As I already told you that there are so many symptoms, and these are all quality of life symptoms. So improve the quality of life by taking a positive stride to everything that is there in your life. Now, at this era of life, you have learned and experienced so much that you know small things do not matter. Okay, things are anyway going to go in your favor, and things, if they don't go into your favor also, you know how to handle them. So take things in a positive stride and try to get control over your body, try to get control of over the symptoms that are coming, and with your diet, exercise, and attitude, grasp everything. So that is how, with a positive attitude, you can think. So that was the third line of treatment. The fourth line of treatment can be meditation. Learn to spend few minutes in meditation daily, so that there is something where you can control yourself. There is some calmness where and the control of your symptoms and your body is in your hand. So start meditation. Number fifth treatment is now, fifth treatment is vaginal lubricants. If there is lot of dryness which is causing problems in sex or anything, then vaginal lubricants are available, both hormonal and non-hormonal, which can be used to prevent these problems. Sixth line of treatment is your treatment of your anxiety and depression. So very small doses of tablets for antidepressants are available, which if you see your psychiatrist or help, can be helped up with these tablets in case they are required during this era. Seventh line of treatment would be something called phytoestrogens. So they are plant estrogen from the plant source. Okay, so there are flax seeds and seeds, whole grain cereals, a lot of things which come into this phytoestrogen category. So there are a lot of phytoestrogens which can be given during this period of time. So to help you recover. So these phytoestrogens do not cure it, but they definitely maybe 30-40% bring down your symptom. So if you have diet, you have exercise, you have attitude, you have meditation, you have your supporting symptoms being treated, then this phytoestrogen may just be sufficient enough to help you cross this era. Okay, the last but not the least treatment would be, would be there is calcium tablets, and those people who have lot of estrogen, loss of osteoporosis coming in, there are specific treatment to increase bone mineral density, and there are weekly regimens, there are monthly regimens, there are injections, tablets, which can be supported along with calcium to increase the bone mineral density and make the bone strong. And last but not the least is the hormonal estrogens. So hormonal estrogens, if at a certain point of time you feel that the symptoms are so bad and they are not effectively helping you, then what can be done is putting yourself in hormone replacement therapy. The hormone replacement therapy are, if you have a uterus, then estrogen progesterone combination. If it is a there is no uterus, then only plain estrogen can be enough. So hormone replacement therapy plays a very important role during these problems of menopause and postmenopause. And if you have hormone replacement therapy. So, depending on your requirement, each of these steps can be taken and supported to help you cross over this era of menopause, pre and post, can be taken care of with the treatment. If there are any questions, I will be happy to answer those questions. Okay. Otherwise, this is all about menopause. And thank you for patient hearing.